Welcome back to Leaders of Healthcare. I'm your host, Shri Ajwalia, and in today's interview, we have a personal mentor of mine for over 2 decades. His name is Dr. Luis Taveras. Now, Dr. Taveras is currently the Senior Vice President, CIO of a very massive system. It's called Lehigh Valley Health System, which encompasses multiple hospitals in Pennsylvania. Now, of course, we'll be able to learn a lot from him from a healthcare administration side, as he's led multiple large organizations from Lehigh Valley, Jefferson Health, working at IBM, also Barnabas healthcare system. So a lot of plethora of knowledge, which we'll get into. But in addition, he's also a published author. He was a bestseller on Amazon, and he's a speaker for multiple large healthcare conferences. So we'll really be able to learn from him a variety of things, but specifically, how do you shape a career that's fulfilling in healthcare? And so I think there's so much to unpack in this interview, and I'll be doing another follow-up video about his book, 90 Day CIO. And again, I can't wait to introduce this audience to Dr. Luis Taveras. So without further ado, let's get into the video.
Thanks, Ray. Great to be here with you.
Thank you, Dr. Taveras. And of course, we have a little bit of a different setting today. We're at your home, so thank you for inviting our team over.
It's great to have you here. Yeah.
Yes.
Yeah.
So Dr. Taveras, I would love to just jump right in, right? Because I think there's so much wisdom that we'll try to unpack in this podcast. But I think one of the biggest things and lessons I feel like we can learn is from your example, where during 9/11, right? One of the world's, maybe really the United States' worst terrorist acts that have ever occurred. During 9/11, September 11, 2001, there was 2 terrorist attacks on the Twin Towers in New York City. Now, Dr. Taveras was the chief information officer at the closest trauma center, really the hospital, St. Vincent's at that time. So you were seeing a slew of patients coming in. So I would love to really orient our audience as to what they can expect from this episode by really taking us and setting the scene by saying, what did you do as the hospital CIO at that time?
So it's a difficult topic for me to talk about because it was such a traumatic day and something that you would never expect to go through, right? So I was sitting in my office at the hospital with one of my directors having our weekly meeting early in the morning, because one thing that I do is I'm there early in the morning. So I like to be one of the first people at work. No matter where I am, I'm one of the first people at work. So we were sitting there early in the morning, and a plane came by, and we're used to having the planes come by, but not that close. I knew something was different because, he just basically buzzed right over the hospital. And my thinking was, I said, Bob, that plane came really close. He probably must be lost, right? So we keep talking, and within 4 or 5 minutes, I get the emergency call saying that we have a multi-casualty emergency in our hands. So I leave, and I go out to 12th Street and outside of the hospital, and I can see the first plane lodged on the tower. And it looks fairly small, right? But it's still sitting on the side. And then a bunch of us had gathered outside at that point, and we see the other plane coming by, and I'm personally thinking that plane is not going to go see what happened to this other plane. And it was unbelievable when we see that plane go in and go through the second tower. Now, at that point, we knew it was completely different. We knew that we had a major, major disaster in our hand. So we ran back across the street to the emergency area of the hospital and started to get all the medical staff to come out, right, to receive patients, and then also start to empty out all the rooms inside as much as we can to get the patients in there and treat the patients that we're going to get. Within 5 minutes of setting up outside, it's kind of chaotic because we're trying to do this on the fly, and you can practice as much as you want, but you never know how it's going to when something really happens. So we have all the medical staff waiting, and there's pictures of us all waiting out there, right? And nobody's really taking care of how we're going to do this. And just instinctively, I kind of took over the whole operation of receiving these patients. We started very quickly to receive patients from just all over. That street is one way coming this way, but we have police cars coming every which way. We have ambulances coming every way. We have people in taxis being dropped off. Anybody, any way they can get them, they're getting us the patients to us. Now, we have an issue because we have one entrance to the emergency area. And now we have people rushing in with patients, and we have people trying to rush out with stretchers and things like that. So operationally, it was just a nightmare trying to get this done while we're trying to figure out how to take care of these patients. And the first patients that we have were really badly hurt. Most of these patients were underground, and they were the first patient that when the planes hit, the jet fuel from the planes, those planes were fully fueled, all that jet fuel came down and it was very hot. So these patients a lot of them were burned, severely burned, and they also got hit by debris coming down from the planes hitting. So what we figured out really quickly was we can't have people running out of the same place, right? So I said, no, this main entrance is only gonna be going in, rushing the patients in. We have a garage next door. Let's open up the garage and come out the garage. So go in this way and come out that way. So now at least you have a good flow. The other thing that we had to figure out was we have these ambulances coming up, but the ambulance coming up, they could barely see from all the dust and everything else that's on the ambulance. So we quickly set up to wash them, really quickly wash them as fast as we could, and then throw in as much supply as we could into the ambulance so they can rush back down. So now we have all these different operations going on at the same time. And again, you don't know how you're going to react. So my big thing was, let's make sure that we can at least have a great way of receiving patients, rushing them in as fast as we can, and not interfere with people trying to come out to receive more patients. And then on the side, do the ambulance operation to get them ready, get everything in there, and rush them back down. So it was just chaotic, receiving all those patients. And then the next few days were very difficult because the number that was being shown on screens throughout the globe, right, was our number to get information on patients. So in the next 2 to 3 days, we have people, blocks and blocks of people set up in line to come and ask us if we knew anything about their loved ones. Right? So it was very, very difficult. But as a CIO, I also have to make sure that unfortunately we didn't lose power, we didn't lose our ability to operate. So I had to make sure that everything was going fine in terms of keeping the information going and being able to track all the patients that we had. The biggest issue was coordinating with the other hospitals because we had never practiced that. So we had a lot of patients that came to us, but they were also being taken to other hospitals. And we didn't know who was where, right? And when people were coming to us to ask, it was really bad because we couldn't tell them. If we had them in our facility, we could, but if they had been taken somewhere else, we probably didn't have a good coordinated effort to keep track. But we did the best we could with what we had. Today is much different, right? Today it's practiced all the time. There's a lot of communication, coordination among the hospitals if something like that happened again, right? So I feel that we are much, much better prepared today in the event of something similar happening. Hopefully we'll never need to do it, but we're much, much better prepared today than we were back then.
Yes, and thank you for your leadership at that critical time, right? I mean, I think the world really owes you, and many of the healthcare staff and workers that were on the grounds and just helping everyone, all the victims. I guess, Dr. Taveras, I think it's a good segue because so much of what you may have learned there has helped you build all the frameworks and knowledge that you've passed on into the 90-day CIO, and you've created the value-based model. So maybe you could talk a little bit about that, because I think, just to orient the audience as well, it's very easy to hear the word CIO and immediately think it's all technology-based. However, you're a healthcare CIO, and just like many healthcare CIOs out in the world today. So there is a little bit of a departure from just the traditional technology role. So maybe you could talk a little bit about that and maybe the value framework that you've created here.
Yes, so the role of CIO has significantly evolved over time, right? We were there in the old data processing days, right? And the computer room and where the CIO and the staff sat was always down in the basement, right? And we were mostly for providing financial systems and those type of things. Some administrative systems, but a lot of financial systems. And for somehow, we were always near the morgue. Right? And I used to be very careful with people that were new to it, because I said, look, if you're squeamish about seeing bodies, right, be careful here, because we're always near the morgue. So if it starts to get very cold, you're getting too close to the morgue. But it's come a long, long way. Come a long, long way, because nowadays you can't do anything in a hospital or a hospital system or any kind of a medical facility without having IT involved, right? We not only drive what happens inside the hospitals, but with everything going on in the world today, We have devices in people's homes. One of the systems that I'm working with, we have over 5,000 devices that sit in people's homes, monitoring their blood pressure, right? Monitoring their weight, monitoring their level of activities. Everything that they do at home, we need to keep track of the patient, because it has come to the point where, and it's the right way to go, which is we don't treat it as an episodic event. That's how we used to treat patients in the past. You got sick, you came to the hospital, we made you better, you went home. Okay? And then, unfortunately, if it happened again, you go through the same setup again. No, that's not the way today. We want to make sure that we treat you, not just when you're in the hospital, but that we keep track of you when you leave the hospital, so that we can make it so that you don't come back to the hospital. Right? So that's the idea, to keep you healthy, not just to treat you when you're sick. Right? And that requires us to monitor people at home, and requires us to be able to really track that patient from the time they present to us, the time they go home, and what they do at home to keep themselves well. Right?
And I would love your perspective on that as well, because now with the dawn of the Apple Watches, the Fitbits, there's so many at-home monitors. I'm just wondering your perspective on it, because I think sometimes data is a great thing, but it's also, for someone in an executive position like yourself, there could be almost an overwhelm of data, right? So I'm just wondering your perspective on all this new technology that's being rolled out in the world. And is it a good thing? Is it a bad thing? Any perspectives there?
It's a great thing, because when people got sick, they came to the hospital, they completely depended on us in the hospital to doing what was right for them. Right? Now, getting people well is a partnership between the healthcare providers and that person. And that's where the personal devices come in, right? Because again, it's a continuous care process. It's not an episodic process. And that's what makes a difference. Right? And hopefully we're going to see much, much better devices, much more powerful devices, much more devices that will allow us to really see what's going on with that person. Right? And then we can use that data. We talk about population health management, right? We can see all that data, aggregate all that data, and do lots and lots of analytics on it to tell us what's going on in the community, right? How effective are we managing the healthcare of the community? We never thought of it that way. We focused on individual patients. Now we're focused on our community and so how we're keeping the community healthy. How do we measure the level of health in our community, and what are we doing to raise that level of health? And that's what all these devices are allowing us to do, and all this data is allowing us to do. So yeah, we generate a tremendous amount of data in a hospital on an annual basis. Right. But now we have the tools to manage that data and to bring a lot of value from that data, not just for the operation of the organization, but also to provide better patient care to the patients that we work with.
And in the community, helping with the initiatives. I mean, you were at the City of Buffalo as well, right? And so,
sure, yeah.
and I'm sure there's many initiatives that you were able to roll out with utilizing all that data, because I hear some clinics or things that we need to set up in the community to help improve the population health management.
And that's the focus, is managing the population's health now. We still have to provide the best care we can to individual patients and their family. That's still the focus, right? That's never going to go away. But how can we expand that to the entire community? And how can we connect different parts of the community? So you have City Hall, you have the fire department that's collecting data on patients when they go rescue somebody. You have the police department that's there trying to track what's going on with people that they have to deal with. You have then taking people to the emergency room, right? So you can see how it's all connected. How do we keep that connected view of the people and the citizens in the community so that we can make better sense of all the data that we collect?
And honestly, we couldn't tee up the book any way better, because at this point, at this juncture of where we are, technology in the world is just almost one and the same. Everything is data. Everything is capturing data in one sense or the other. And the role of the CIO is now evolving as well. It's actually growing in importance. And I love your perspective on that, because you've had such a long career as well, where now the CIO must be sitting at the boardroom, because there's so much technology involved. And now you need someone at a highest level to really manage everything and lead the organization. So not everyone is just going executional. I know you're very big on reactive versus future focused. So I would love your perspective on the leadership of the CIO and why is it so important today?
Yeah, so my take on the role of CIO today is that we have to be general managers first. We have to be a part of the leadership team of the organization that happen to have the expertise in technology. Just like we have a CFO that is a big part of the organization and happens to be having expertise in finance, right? Chief medical officer, same type of thing. So we all are working together, and you have to be able to operate at that level. Right? I don't need to know the bits and bytes anymore like I used to in the past when I was starting in this industry, right? 30, 40 years ago. I need to be able to converse at that level, take what they say, and come up with things myself. Suggest different things myself, how we can do to operationalize better the organization and provide better patient care. So I'm a general manager first, and then I'm a CIO of the organization. And that's the way that I operate. So that's a huge, huge change. And that's why you see the CIOs now reporting to the CEO, I used to report to the chief medical officer, right? So that's a big change that's happening in the role of CIO.
It's a huge change. And I think the other piece of it, and I love how you just mentioned it, it's the general manager, the management piece of it. Because it's not that, to become a CIO, many in our audience may aspire to get to that executive board position in the IT industry with CIO. And it's not just that you have to be the smartest tech person, how to, be the best programmer or be the best, hacker or be the best security person. No, you have to also understand the management piece of it. How do you actually manage thousands of people and actually drive them to effective change and delivering impact for the organization? And, I think at this point, maybe we talk about the model. Okay. Because the model, I think, is really the output of the culmination of your life's work, right? And all of your experiences. And maybe we could flash it on the screen right now as well, because, and I would preface, although the model focuses on outcomes and value in the middle, but I think it's also applicable to other industries as well. So maybe we can just talk, maybe we start with the model, let's give a little quick overview, and then maybe we could talk about how its relation to many other industries and, how it can be applicable.
So I think it definitely does apply to other industries. I so happen to be talking about it from a healthcare because that's what I do. But basically, in the middle of the model, our focus in healthcare is to provide the best patient care that we possibly can and not forget about the family of the patients too. So that's why I focus in the middle about patient care and patient value to the patients, to the family, and value to the organization, right? So that's the center, that's what our focus is. But you have to remember that nothing operates on its own. So the key is, what is the culture that we create that will enable us to actually provide the best care that we can bring the best value to the organization? Because the organization is investing on us in IT. Major investments are going into IT, right? They could just as well take those funds and invest in building a new hospital, a new clinic, whatever it is, right? But they're investing it in us. And it's up to us to make sure that we bring the most value to them, starting with patient care and then with the organizational value. Creating that culture, right, is absolutely critical because we can have the strategy, best strategy that we possibly can. But we all know, and I mentioned it in the book, that culture will eat strategy for lunch, for breakfast, and for dinner any day there is, right? If you can have a great strategy, if you don't have the right culture, it will not get anywhere. So we have to make sure that we have that great culture that we create. And then around that culture, you have people that are accountable, right? You have people that feel engaged to the organization, right? You have people that absolutely understand what it means to manage financially the organization. Because if we don't have any money, we're not going to provide any care, right? So we have to make sure that culture and the outer layers are there, right? And on top of that, surround the whole model, of course, is governance. Because we can have great strategies, we can have great plans, but if we're not working the right way with everybody in the organization, everybody pulling together to make this happen, it's not going to happen, right? So that's why the governance model is absolutely critical, that we have a governance model that engages everybody, that we heavily communicate with everybody, and that we measure, right, how we're doing. We have to be able to measure how we're doing. Otherwise, how do we know that we're doing better? Anecdotally, that doesn't work. Okay? So that's what the model is about, is really guiding us in the different layers of what we have to do to create a high-performance organization. Because at the end of the day, that's the big strategy, to create a high-performance organization.
So the model is something that you would bring into the organization. Now, why the 90-day CIO? Why did you pick that 90-day time frame? I'm just curious.
So the key, what I have found when I've gone into organizations, either as a CIO or as a consultant in the consulting world, is that first 90 days is when you're establishing yourself and setting up your plan. It doesn't mean that you're going to complete your plan, because you're going to set up a 5 years, 10-year strategy, right? But in that first 90 days, you're building that foundation. You're building credibility. You're letting people know what you expect from them and what they should expect from you. You're building trust-based relationships with the rest of the executive team, right? You're letting people know what you're all about. And that 90 days is absolutely critical, that people see what you're planning on delivering to the organization. You're not going to go there and spend a whole lot of time studying things and learning things. No, you're going to go there and you're going to do something. I believe in acting, right? We can talk all we want, but we need to act, we need to show, we need to deliver. And that 90 days is setting up that plan on how you're going to deliver, right? And you're going to find out in that 90 days who's with you, who's not, right? So there are a lot of decisions you're going to make that first 90 days. But that's why that 90 days is critical. It's not that you're going to have a whole plan, of course, right? But it's that you're going to set your plan and you're going to set the example of how you're going to execute on that plan.
And it's not to say that the 90 days will set you up for the rest of the journey.
Yeah.
And I think the way you've structured in the book, I love it, because you give, at the end of every chapter, you give specific, you mention actions. You give actions at every chapter of what the individual should do to enact each piece of the model. How to enact outcomes and value, how to actually act and improve the culture, and so on and so forth, financial discipline, engagement, accountability, operational excellence, and governance. So those are the actions. Is something, while I was reading this, I really found that was something that we need to bring that to the world, because that's the actionability. This model is still very relevant because it at the heart of it, it still focuses on the client, who is our customer at the end of the day, and then you expand outwards, and all of these things can be built into any business, really. It doesn't have to be a hospital, honestly.
Yeah, I think the model is definitely applicable in any industry that you're working in, right? It's definitely applicable. And the idea of the to-dos at the end of each chapter is because what I want to do is after you're done reading the book, you should have your 90-day plan. That's what I'm helping you to develop, that 90-day plan. Now, is it completely prescriptive? Somewhat, right? But there is some room there because every organization is different, right? So you need to tailor it as much as you can for your organization. But I want to give you 80, 90% of what you need when you're done reading the book.
Yes. And the big value I found is that it distills really the important principles, because it's so easy to get diverted, especially in an executive position. You're getting hit with so many resources and information, and you've really distilled all of your expertise into this book. So it's very clear, you're giving a very clear guidance of how to move forward, and it's within the value-based framework. So it's very clear and distinct to what you should be doing at every step of the journey. That's what I really found the value is. It's all distilled down.
Yeah. No, that's the idea. I don't want to make it too complicated, right? Because it really is not. Mm-hmm. You have the talent. That's why you've been given the opportunity to in this position, right? But you have to be focused. You have to have discipline. You have to have strategies, right? And that's all I'm trying to help you here, to just get those things done and do it and at least have that foundation in 90 days of how you're going to execute going forward.
Yes, and that is so critical. I feel like it's very easy to lose focus when you're at such a high level position. It's very easy to lose focus and always find the new shiny object. But this really grounds a CIO or any chief executive officer to say really be grounded in how to really drive the organization from reactive to future focused. That's really what I found is a big value for me when I read this book every time.
It's pretty easy to, when you're at this level, right, and have so many responsibilities, so many different types of responsibilities, it's very easy to lose your focus. Mm-hmm. Right? And what happens when you do that is that you end up accomplishing much less than you should accomplish. So this will help you to stay focused, to remain focused, and stay on track with what you got to accomplish.
So in the spirit of moving our organizations forward, and obviously the second half of our podcast is self-management. And I know you're a big advocate for that and something that you've taught me personally on my own leadership journey. I would love to hear about your personal philosophy of self-management. How have you been able to maintain such a high level of performance, right? Working as a senior partner at Accenture to being a senior VP CIO at multiple healthcare systems, even working as the CIO of City of Buffalo, right? So many different organizations, so many different roles and hats you had to play. But what was that one thread that kept you, that self-management philosophy that really kept you to maintain high performance at each of these organizations and drive that incredible value?
So if I was to pick one thing, and there's so many different things, and we'll talk about those, but I think if there's one thing, is that you have to be yourself. Mm-hmm. If people see me in different ways, right, there's a level of trust that doesn't develop. There is that connection that you have to have with people, because at the end of the day, we're working with people, right? We're not working with robots. Even from the IT environment, we're not working with computers all the time. We're working with people. And my philosophy of people is, you have to treat every single person the way that I want to be treated. And I tell people, whether I meet somebody in the boiler room or I meet somebody in the boardroom, I treat them exactly the same, because that's what's going to get you where you need to get. People will help you get where you need to get. You can never do this alone. So basically, it is being a true person, right? And showing that. If somebody runs into me in the street in the middle of Buffalo, right, it's the same as if they met me in my office in the city of Buffalo, because I'm the same person. You have a lot of people that are different. No. I'm the same person no matter where I am. No matter whether I'm wearing a suit or I'm wearing shorts and running around on the street. So that's one absolutely key thing. You have to be yourself. You have to be honest with yourself, and people have to see that. Right? The second thing is, there's no question that you have to work hard. And you have to set the example. I mentioned earlier, I like to be the first one there. I get to the hospital at 6:30 in the morning. Right? I don't care what kind of commute I have. I get there at 6:30 in the morning for two reasons. One is I like to get there before everybody gets there so I can plan my day. Because once everybody starts showing up, things start to happen, right? Mm-hmm. So by the time people start showing up, I already planned my day. I already read through my emails. I already went through my voicemails, everything that we have, right? Mm-hmm. So I start the day that way so that I can really, really control what happens. That's the time that I can control when nobody's there. Mm-hmm. Once people start to show up, right, they'll knock on your door, somebody's calling you, right? But that gives me the time to really plan my day. Mm-hmm. So work hard and plan your days, right? Because otherwise, you're going to be all over the map, right? So that's absolutely critical, to make sure that I'm there first and that I'm as organized as possible. No matter what happens through the day, I'm in control, right? I know what's going to happen and how I'm going to do it, right? So that's critical. Time management, right, is absolutely critical. Right? I do not want to be late to any meeting. It just shows bad when you're showing up 15, 20 minutes late to a meeting. You have to really show respect to everybody you work with. And to me, to show up 15, 20 minutes late to a meeting says, what I was doing was much more important than being with you. Even though I said time with you, right? I was doing something much more important. That's not a good message. That's not the kind of message that I like to give.
And to expand on that, because I think right now, a lot of people, especially on the internet, they love hearing about people's schedules. And how did you manage your time while in these, just pick any of the positions you've worked at, how did you manage your time? Just for example, what time did you go to sleep at night? What time did you wake up? How did you actually manage even family responsibilities throughout your roles, right? Maybe if you can give us like a rough day in the life of.
Yeah, so I don't see 10 o'clock at night very often, right? Because I get up very early, right? So 9:30, I'm gone. I'm in bed, right? And if there's social events that I have to go to, yeah, I go to those, because you have to be part of those events, right? You have to be part of the community you work with and the people you work with. But I make sure that I'm home in time to go to bed, so that when I get up in the morning, pretty early in the morning, I can get going and do the things I have to do. So no, I'm not up very late, but I'm up very early in the morning. I also have to figure out, because it's important to me, how I'm going to exercise during the day. So am I going to go start early in the morning or do it late at night? But I'm going to figure out a way to exercise every day. And then the key is, and it's amazing, people say, how can you have so many meetings in one day? Because my assistants are, so I book these meetings. And the key to that is, people understand that I like to be on time. Mm-hmm. So before we start a meeting, I need them to be ready for the meeting, and I need to be ready for the meeting, so that we can go right to it and go through and cover everything that we have to cover in the time that we have allotted. Right? So that's how I manage my day, that's how I manage my time. I don't take much lunch, right? It's a long day with lots of people, lots of meetings that I have to go to, but I have to manage it that well, and you have to be prepared. That's the key, being prepared. I don't chit-chat a lot, right? Because I don't have the time to do it. I wish I had the time to do it. So while my day is going on, I'm not spending a lot of time chit-chatting with a lot of people or doing things that I shouldn't be doing to stay focused on what I'm doing.
And I think there's so much packed into that, to be honest. But one thing that has always stuck with me is a personal anecdote of mine. You may not even recall this, but I've been in your boardroom offices so many times I can't count. But there was one thing that I do to this day, and I don't think I've shared this with you as well, even in my own office at Keshri, I keep a clock, but only in one place in the whole office, and it's behind the guest chair. And that's something you taught me. And that's because obviously when you're talking to somebody, they shouldn't see you looking at your watch or looking on the clock somewhere. But if they won't realize, but there's a clock behind them, so that's how you're keeping track.
I always do that. I always have a clock behind the person that I'm meeting with, because like you mentioned, I don't want them to see that I'm looking at my watch. That's disrespectful to me, right? That means that I'm not even paying attention to what you're saying. Once somebody does that, that's kind of the message that I think it gives. And that's not a message that I want to give. Because I'm sitting with you, you're the most important thing for me right now. And I have to make you feel that way, right? So no, I'm looking at it, but you don't know that I'm looking at the clock.
Yes.
And again, I need to keep track of the clock because I need to get to the next thing that I'm doing. If I have an hour open after that, not as big a deal, but that doesn't usually happen.
Yes, of course not. And in the same vein, Dr. Taveras, Monday through Friday, of course, you're at the hospital, you're at your organization. How do you organize your weekends as well? Because I know you're a big family man, right? And how do you manage that part of your life? Any tips or tricks that you can share and impart any wisdom on how to manage a high-performance career as you have, but also have a very loving family and building the culture in your family? I know your family is very, wonderful. So I wonder, how did you able to also do that? Because it's important, I think.
So there's something that you really have to do, and I know that it's getting more difficult with people working from home and those type of things, but you have to have a definite line between work time and at home time, right? And just like I do with the people at work, when I'm sitting here with you, I have to make you feel like you're the most important person that I have right now. And that absolutely is true, right? I'm sitting here, committed to be here with you, so I'm committed to be here with you and pay attention to what we're doing. It's the same thing at home, right? We have to pay attention to our family members, and we have to spend the time, but make them feel, right, that they're the most important thing, because they are the most important thing to me, right? And that doesn't mean that I don't take a call from work, because of course, right, we have emergencies that happen. We have a lot of things that happen with how many systems we're running today, right? How big the organizations are that we're working with. But I need to make sure that I stay focused when I'm on the weekend at home. I stay focused on my family at home. And again, they know that even on the weekends, I'm not out very late, right? Because that's just my nature, right? And then once work comes, of course, I stay connected with them, but they know that I'm focused on work.
Got it. So making sure that you have that good partition between family life and work life, but wherever you are, you try to stay present.
That's right, yeah.
Got it. And in the same culture, I think, in talking about culture at your organization, culture in your family, is there anything that you've done in your family life or in your personal life, maybe build a good culture? Because, I've gotten to know your family a little bit, and I see that everyone kind of has this air of, high performance too. And everyone wants to kind of push the envelope a certain degree. Everyone's very positive. Is there anything that you've kind of done? You've raised many children. You have grandchildren now. Is there something that you do? Any secrets that you've done to say, hey, this is how we kind of do it the Taveras way, so to speak?
Yeah. So it's they understand what it means to be with each other, and we love being with each other, right? I'm fortunate enough that the kids and the grandkids are all around here. So they understand how when we're here, we're going to dedicate ourselves to being with each other, right? We also have to make sure, just again, same as work, right, that I'm going to support them in any way they can. And they have been tremendously supportive of me is I have done all these different things to get to where I am. Going to school, being a student for so long, right? Traveling. I was on the road a lot, all over the globe, right? And they understood that I was doing that, but they were right behind me supporting me. So that support, regardless of what's going on, of course we all have issues at home and all that stuff, but they need to understand that I'm here for them, right? And that I will support them in a way that I can.
It's that mutual support that's really been the biggest foundational rock. Yeah. Interesting. Okay, I think there's a lot of wisdom packed in that gem, and I think it's apparent, obviously, in your office. The audience can't see everything, but yes, it's very apparent. And so, I guess, Dr. Taveras, transitioning a little bit, I'd love to know a little bit about your personal story, because a lot of people will see someone like yourself in this high position and say, "How can I ever get there?" But I think, respectfully speaking, you've come from a humble background, as you've shared with me as well. Yeah. And I think there's inspiration in that story. So maybe you could share a little bit about how did you get to where you are today?
So I'm one of 13 kids from the Dominican Republic, and we were all born in the Dominican Republic. And we were fortunate enough to be able to come to this country and to really have an opportunity like no other to be able to be in this country. We came from very, very poor background in the Dominican Republic. But one thing that we always saw was our parents working very hard for us to get ahead. Right? So that's something that we learned early on. And I think that's something that I've carried from them and taken forward. Hopefully my kids have the same thing, which is you have to work hard, right? You have to have patience, right? And you have to have faith. Those are the three big things. In Spanish, we have a say actually that is partially there, which is we say paciencia y fe, right? Have patience and have faith. I add a third component to that, which is work hard, right? So I say have patience, have faith, but make sure that you work very hard on what you need to do, right? Because I think those are the three things that are going to carry you forward. It kept me going when we came to this country. I had to learn to speak English. I had to learn to live in this culture, right? I had to learn to, when I went away to school, I had to learn to live in that American culture, right, which was very different than what I grew up with in the Hispanic culture, right? When I went away to high school, I was fortunate enough to get a scholarship to go away to a high school, and the first 3 months there, I really, really had trouble because I had never been away from my family, right? I had never had really American food. We always had Spanish food, right? And they thought that when Thanksgiving break came from the first year that I was there, that I was not going to go back, okay, right? Because they saw how much different it was for me. But guess what? I went back, right? And I worked very hard to not only integrate into that culture and to do well. I ended up, that was a high school, I ended up graduating the top 10% of my high school in a completely different environment. So it's just dedicating yourself, and again, having faith on yourself and the people that you're working with, those that are around you, right? Making sure that you work very hard on whatever you do, right? And have patience. Things are not going to happen on my time, even though I'd love that to be the case, right? But it doesn't happen that way. But have patience. Things are going to happen when you work hard.
Patience, work hard, and faith.
And faith. Those are the three big things, yeah.
Interesting. And Dr. Taveras, in bringing it back to our business principles, obviously you've been able to lead all these organizations. You've written this book. Why did you write this book? Like, why? Why now? Why is it so important for you to have given this contribution to the world? I think I have many reasons. I've already been an early reader of this book, luckily, being on the publishing side of the things. But why did you write the book? Because, just curious, as the writer.
So, I wanted to always write a book, and of course I wrote my dissertation, all that stuff, which is a book in itself, but I want to write a book like this because I want to pass it on. Right? I want the folks that are out there thinking about being a CIO, CIOs that are fairly new in their position, I want to give them something. I want to pass this on. I've always done that, right? I've always figured a way to give and to teach people and to do all this kind of thing. That's all this book is about. It's just trying to share with people what my experience is to guide them as they go into the success that they're going to have. If I can play one tiny little role in their success, I'm happy. That's what this book is all about.
That's amazing. And that's what brought me to publishing, to be honest, is because publishing really allows you to exponentially share your message, right? And that's something that can never be duplicated, and it's also timeless. Of course, at Keshery Publishing, we do print publishing through books, brochures, sales aids, and also clothing, but we also do digital marketing. In the digital world, as we're seeing today, also allows you to expand your message really globally, for places where a book may not even be able to reach. So I'm very happy we're able to have this discussion, Dr. Taveras. Any parting words or last messages for our audience? Maybe something that I may have not thought to ask you, but you would like to share with our community here.
So one thing that that I would like people to know is, how do you move ahead, right? And people say, "Oh, you don't talk enough about yourself." I don't like doing that, right? I don't like to toot my own horn. I would like people to see what I do, and I like people to judge me based upon what I do and how I do it, right? Not upon what I say. So I don't like to be out there talking about things that we do, about myself, all that stuff. I like people to see the results. So results oriented, right, is the key. If you show results, people will see it, and people will respect you, and people will know what you're all about, right? So focus on results. And yes, you got to do it the right way, high quality. You got to create a high performance organization that we're talking about here, right? But it's the results that count. And that's what people need to focus on, the results. And how do you get there in the most effective and efficient way that you can, so that you increase everybody's productivity while you're doing this, right? And get the results that you expect.
Focus on the results and really just be able to keep your head down and work hard.
Be a results-oriented person.
Lead by example.
Yeah, and lead by example, absolutely.
I love that. All right, excellent, Dr. Taveras. Well, thank you very much for your time.
Thank you for having me. Thank you. And thank you for your help with the book. Thank you.